our examination of him. He's quite overweight.
Yes, I'm feeling a lot better, thank you. But I shall have to go because I need to go to the toilet because the doctor will be coming round soon. All right then. Bye.
Ivy, what's happened?
Oh, a fall.
Have you hit your head?
I don't think so.
No?
So, no.
Okay, just take a minute. Alright.
Just turn this alarm off.
Should we try and get you sat up onto the chair? Yeah?
Just stay there a second.
There we go. Just take your time. Just when you're ready, try and move over. That's it, use the frame. There we go. How's that feel?
Alright.
Alright?
Yeah.
Just get your bearings again. Is that the first time you fell?
Yes.
Okay.
Yeah.
Take it steady.
Yeah.
Okay. Should we take a walk back to the bed with the two of us?
Yes.
Yeah?
Please.
Okay. Okay, gently does it. There we go. That's it. Okay then, Ivy, we'll get you back to your chair.
Yeah.
How are you feeling?
Alright.
Alright?
Yeah.
Good. There we go. Pop your arm in there, turn yourself round. Put the chair at the back of your knees and then just lower yourself down. There we go. Alright?
Yes, thank you.
Hi doctor, it's charge nurse on ward 44. I've got a lady that I need you to come and review, please. She's had a tumble in the bathroom. She's a 90-year-old lady, came in with chest infection, query TIA, all now resolved. Just waiting for social input. We did her obs and they're all within normal limits. Sat to 97%, blood pressure is 122, systolic, temperature 36.4, no recollection of banging the head, no past history of falls. We've got her up onto the chair and onto the bed and just need you to come and review if you can. About 10 minutes? Excellent. Thanks doctor. Bye.
Hello, is it Ivy?
Hello. It is, yes.
Hi, I'm Dr. Quinn. I'm the junior doctor on call.
Hello.
Can I just check your full name and date of birth?
Yes, IVX, the 1st of January, 1927.
Okay, thanks very much. Nice to meet you, Ivy.
Patient is alert and appears comfortable. It is suitable to proceed on to taking a focused falls history.
So I heard you had a bit of a fall.
Yes, I did.
Okay, can you tell me a bit more about that?
Yes, I'd gone to the toilet, got up to flush the toilet, and I felt very lightheaded and a bit dizzy.
Okay.
And I wanted to pull the red cord. I took a step back and fell over the yellow bollard that was on the floor.
Yep.
And I fell back, hit the wall, slid to the floor, and then had to crawl across to pull the red cord.
Okay.
Yeah.
You said you hit the wall. Did you hurt anything?
No.
No.
No, I didn't.
Okay.
No.
Did you have a blackout or faint at any point?
No.
Okay. And you said you felt a little bit lightheaded, dizzy.
Yes.
Was the room spinning, or was it just
No.
lightheadedness?
Just a bit lightheaded.
Okay. You still feeling like that now?
No.
Okay. Did you feel sick at all, or did you vomit either during or after?
No.
Okay. Did you feel flushed? Could you feel your heart beating in your chest?
No.
No.
No. Okay. Did you have any chest pain? at any point?
No.
No, I didn't.
Notice you've got some glasses there.
I wear them for reading.
Yeah. Okay.
Yeah.
Any other eye problems at all?
No.
Okay. And do you use a walking aid at all?
No. No, none at all.
Okay, that's fine. Just going to do a quick examination if that's okay.
Yes.
Top to toe to see how you're doing.
Yes.
See if you hurt anything in the fall. start by listening to your chest.
All right.
But let's pull the curtain round first.
Okay, thank you.
Just got the OBS machine here. I'm going to check your oxygen saturations, if that's okay.
Yes.
So I'll just put this on your finger. It's okay, just this finger here. Be great.
Thank you.
Thank you very much.
Here, junior doctors must perform a chest examination to assess breathing. If there are any abnormalities, then these must be addressed before moving on to assessing circulation.
So now I'm just going to listen to your heart.
Yes.
It is important to be mindful that if a patient has extra heart sounds or murmurs, there may be underlying valvular disease. These may need to be followed up with an echo scan. Additionally, 12-lead ECG is helpful in detecting underlying arrhythmias such as atrial fibrillation. This is essential, as cardiac arrhythmias may not always present with symptoms. This patient did not experience loss in consciousness or palpitations. Therefore, this was not a syncope.
That's fantastic, thank you. Now I'm just going to take your blood pressure. Just roll the sleeve up for me here. Thank you very much. And put your arm like this.
Lying and standing blood pressure can help to determine if there is a postural drop. Drop in systolic blood pressure by at least 20 or by 10 in the diastolic indicates postural hypotension. This patient had a postural hypotension. There are many causes to postural drop, such as medications, hypovolemia, and autonomic dysfunction secondary to diseases such as diabetes and Parkinson's disease.
So I'm just going to have a little look in your eyes, if that's okay.
Right. Yes,
Just shine
of
a bright
course.
torch in them. Just stare straight ahead for me.
Assess the GCS and mental state to rule out delirium or impaired cognition. You will also need to establish blood glucose levels. Confusion, hypoglycemia, and dehydration can increase the risk in falls. If there is a decline in response, then this may warrant further investigations such as CT head scans.
Okay, fantastic. So Ivy, now I'd just like to have a little look at your walking, if that's
Yes.
okay. Are you in any pain at all?
No.
Let's go. Alright, so if you wouldn't mind just walking from there to the end of the curtain.
Yes.
It's okay. You feeling okay?
Yes, fine, thank you.
Watch the patient to see whether they can stand independently without discomfort. Perform a full-body neurological examination as well as focusing on gait and balance, as these can all increase the risk of falls. Look out for any pain or leg length discrepancy, as these can point towards a potential neck of femur fracture. As well as performing a cranial nerve examination, it is important to inspect and palpate the head to identify potential soft tissue injury or swelling that may correlate with neurological deficits.
Just gonna have a little feel down your spine now. if That's
Right,
okay. Let me
yes.
know if there's any pain.
Okay.
If a patient complains of bony tenderness, beware that this could be a spinal fracture and would require further imaging. An assessment of fragility status would also be essential in these patients.
Okay, thank you very much for that, Ivy.
That's all right. That's
I'm
all
just going to
right.
have a little look at your notes now.
Now review the patient's notes and current medications. It is important to understand why the patient was admitted to hospital, what their past medical history is, whether they had previous falls during admission or in the last 6 months, and social history with baseline functional status. If a patient has more than 5 drugs, then this is polypharmacy. This means the patient may have a greater risk of side effects as well as a greater risk of drug interactions. You should be aware of certain classes of medications that can increase the risk of falls. However, if unsure, check the BNF.
Hi there, Doctor.
Hi, Carl.
Could I just have the update of the plan, please?
Yeah, absolutely.
Yeah.
I had a good chat with her.
Okay.
She's in one piece, which is the good news. But I think there's a couple of things that we could be doing.
Okay.
First off, I think we definitely need to have hourly neuro-obs
Okay.
for at least the next 4 hours. If you notice any change in the mental state, or if she starts complaining of any pain, we might need to consider scanning. I didn't find any evidence of head injury,
Okay, yeah.
but yeah. Also, looking through her medications, we did a lying standing blood pressure, and she had significant postural drop. So I think we should stop her amlodipine and ramipril
Okay, yeah.
until the systolic is above 130.
Right.
In addition, I noticed she's been put on temazepam. Why is
Yeah,
that?
she wasn't sleeping too well, to be fair, so it started a few days ago.
Okay. All right. It's probably not a great idea to have her on a benzo
Right, okay.
tolerance, and also it's a falls risk as well.
Okay.
So we could get her off that.
Yeah.
That would be great. I know it's not easy to sleep in hospital, but
Well, we can get the day team to review that as well, can't we?
no worries. Okay. In addition, I'm going to do a frac screen,
Right.
just check for vitamin D deficiency on the system, see what's going on. And I know she's got a background history of an overactive bladder,
Yeah.
so I do wonder if the medical team could review that
Okay.
tomorrow. In addition, I think we're going to hold the confusion screen.
Okay.
And she didn't seem too confused at the moment.
No, she seems all right,
But
yeah.
we'll see what happens. Okay, in addition, she's barefoot, isn't she? So get some socks on her, warm those feet up.
I'll get that
That'd be
arranged. Yeah.
Perfect. Anything from your end?
I've just got to update the falls assessment. If you
Yeah.
can just update the CGA falls assessment, and I'll let the family know.
It'd be my pleasure. I'll let her know what the plan
Okay.
is.
Thank you.
Thanks very much, Colin.
To summarize, go through patient's past medical history to identify conditions that can increase the risk of falls. Review drug chart to identify medications that increase the risk of falls or are unnecessarily prescribed. Remember, patients with neck or femur fractures may still be able to walk. Regardless, minimize environmental hazards and optimize mobility whenever possible.